Welcome to the American Association of Orthodontists Informed Consent video. You've been asked to watch this video because successful orthodontic treatment is a partnership between the orthodontist and the patient. The doctor and staff are dedicated to achieving the best possible result for each patient.
As a general rule, informed and cooperative patients can achieve positive orthodontic results. While recognizing the benefits of a beautiful, healthy smile, you should also be aware that, as with all healing arts, orthodontic treatment has limitations and potential risks. These are seldom serious enough to indicate that you should not have treatment. However, all patients should consider the option of no orthodontic treatment at all and accepting their present oral condition.
Alternatives to orthodontic treatment vary with the individual's specific problem, and prosthetic solutions or limited orthodontic treatment may be considerations. You are encouraged to discuss alternatives with your orthodontist prior to beginning treatment. As you view this video, please follow along on the informed consent form. If you have a question about anything you see or hear, stop the video and write your question down. Be sure that your questions are thoroughly answered before you sign the form. Orthodontic treatment usually proceeds as planned, and we intend to do everything possible to achieve the best results for every patient. However, we cannot guarantee that you will be completely satisfied with your results, nor can all complications or consequences be anticipated. Much of the success of treatment depends on patient cooperation in keeping appointments, maintaining good oral hygiene, avoiding loose or broken appliances, and following the doctor's instructions carefully.
The length of treatment depends on a number of issues, including the severity of the problem, the patient's growth, and the level of patient cooperation. The actual treatment time is usually close to the estimated treatment time, but treatment may be lengthened by, for example, unusual jaw growth, oral habits, gum disease, or poor patient cooperation. Therefore, changes in the original treatment plan may become necessary. If treatment time is extended beyond the original estimate, additional fees may be assessed.
The mouth is very sensitive to changes, and the introduction of orthodontic appliances means that you must expect a period of adjustment. There may be some occasional discomfort associated with orthodontic treatment. This can usually be resolved by using a simple, over-the-counter pain medication.
Regular retainer wear is often necessary for several years following orthodontic treatment. However, changes after that time can occur due to natural causes, including habits such as tongue thrusting, mouth breathing, and growth and maturation that continue throughout life. Later in life, most people will see their teeth shift. Minor irregularities, particularly in the lower front teeth, may have to be accepted. Some changes may require additional orthodontic treatment, or in some cases, surgery. Some situations may require non-removable retainers or other dental appliances made by your family dentist.
Some cases will require the removal of deciduous or baby teeth or permanent teeth. There are additional risks associated with the removal of teeth, which you should discuss with your family dentist or oral surgeon prior to the procedure.
Some patients have significant skeletal disharmonies which require orthodontic treatment in conjunction with orthognathic or dental facial surgery. There are additional risks associated with this surgery which you should discuss with your surgeon prior to beginning orthodontic treatment. Please be aware that orthodontic treatment prior to orthognathic surgery often only aligns the teeth within the individual dental arches. Therefore, patients who discontinue orthodontic treatment without completing the planned surgical procedures may have a malocclusion that is worse than when they began treatment.
Excellent oral hygiene is essential during orthodontic treatment, as are regular visits to your family dentist. Poor hygiene may result in cavities, decalcification, discolored teeth, and/or periodontal or gum disease. These same problems can occur without orthodontic treatment, but the risk is greater to an individual wearing braces or other appliances. These problems may be aggravated if the patient has not had the benefit of fluoridated water or its substitute, or if the patient often consumes sweetened beverages or foods.
The roots of some patients' teeth become shorter during orthodontic treatment. It is not known exactly what causes root resorption, nor is it possible to predict which patients will experience it. If resorption is detected during orthodontic treatment, your orthodontist may recommend a pause in treatment or the removal of the appliances prior to the completion of orthodontic treatment.
A tooth that has been traumatized by an accident or deep decay may have experienced damage to the nerve of the tooth. Orthodontic tooth movement may, in some cases, aggravate this condition. In some cases, root canal treatment may be necessary. In severe cases, the tooth or teeth may be lost.
Periodontal disease, or gum and bone disease, can develop or worsen during orthodontic treatment due to many factors, but most often due to the lack of adequate oral hygiene. You must have your general dentist, or if indicated, a periodontist, monitor your periodontal health during orthodontic treatment every 3 to 6 months. If periodontal problems cannot be controlled, orthodontic treatment may have to be discontinued prior to completion.
Orthodontic appliances are not toys. All patients must avoid activities and foods which might loosen or dislodge parts which could be swallowed or inhaled. You should inform your orthodontist of any unusual symptoms or of any loose or broken appliances as soon as they are noticed. Damage to the enamel of a tooth or to a restoration, a crown, bonding, or veneer, is possible when orthodontic appliances are removed. This problem may be more likely when clear or tooth-colored appliances have been selected. If damage to a tooth or restoration occurs, restoration of the involved tooth or teeth by your dentist may be necessary.
Headgear may be prescribed to aid in your orthodontic correction. If so, you need to be aware that orthodontic headgears may be dangerous and could cause injury to the patient. Possible problems include injury to the face or eyes if used incorrectly. A headgear should never be worn when there is a chance that it could be bumped or pulled off. This includes many sporting activities, especially contact sports. Don't engage in horseplay when wearing a headgear.
Problems may occur in the jaw or temporomandibular joints, causing pain, headaches, or ear problems. Many factors can affect the health of the jaw joints, including past trauma, such as blows to the head or face, arthritis, a hereditary tendency to jaw joint problems, excessive tooth grinding or clenching, a poorly balanced bite, and many medical conditions. Jaw joint problems may occur with or without orthodontic treatment. Any jaw joint symptoms, including pain, jaw popping, or difficulty opening or closing, should be promptly reported to the orthodontist. Treatment by other medical or dental specialists may be necessary.
Teeth may become impacted or trapped below the bone or gums, ankylosed or fused to the bone, or just fail to erupt. Often these conditions occur for no apparent reason and generally cannot be anticipated. Treatment of these conditions depends on the particular circumstance and the overall importance of the involved tooth, and may require extraction, surgical exposure, surgical transplantation, or prosthetic replacement.
At the end of treatment, there will still be some minor imperfections in the way the teeth meet. This may be due to irregularities in the shape and size of the teeth, dental restorations, etc. For these reasons, an occlusal equilibration may be necessary. This procedure fine-tunes the occlusion by grinding away small amounts of enamel. It may also be necessary to remove a slight amount of enamel between the teeth, making flatter surfaces to reduce the chance of relapse.
Due to the wide variation in the size and shape of the teeth, missing teeth, etc., achievement of an ideal result, for example, complete closure of a space, may not be possible. Restorative dental treatment such as aesthetic bonding, crowns, bridges, or periodontal therapy may be indicated. You are encouraged to ask your orthodontist and family dentist about adjunctive care.
As third molars or wisdom teeth develop, your teeth may change alignment. Your dentist and/or your orthodontist should monitor them in order to determine when and if the third molars need to be removed.
Occasionally, patients can be allergic to some of the component materials of their orthodontic appliances. This may require a change in treatment plan or discontinuance of treatment prior to completion. Although very uncommon, medical management of dental material allergies may be necessary.
General health problems such as bone, blood, or endocrine disorders, and many prescription and non-prescription drugs, including biphosphonates, can affect your orthodontic treatment. It is imperative that you inform your orthodontist of any changes in your general health status.
If you have ever taken biphosphonate medication to strengthen your bones, you should be aware that long-term biphosphonate use has been observed to decrease bone healing. It is possible that tooth movement and any surgery procedures performed within the jaws or bones surrounding the teeth may be difficult, and in some cases, no bone healing may occur. All biphosphonates have the ability to and probably will inhibit tooth movement during orthodontics. This issue may slow your response to orthodontic movement or lengthen or otherwise negatively affect your orthodontic treatment time. The effects of these medications may be severe enough to stop tooth movement, which may cause braces to be removed regardless of favorable or unfavorable tooth position. No orthodontist can predict the effect biphosphonate will have upon an individual's tooth movement.
Smoking or chewing tobacco has been shown to increase the risk of gum disease and interferes with healing after oral surgery. Tobacco users are also more prone to oral cancer, gum recession, and delayed tooth movement during orthodontic treatment. If you use tobacco, you must carefully consider the possibility of a compromised orthodontic result.
Your treatment may include the use of a temporary anchorage device, a metal screw or plate attached to the bone. There are specific risks associated with them. It is possible that a screw could become loose, which would require removal and possibly relocation or replacement with a larger screw. A screw and related material may be accidentally swallowed. If the device cannot be stabilized for an adequate length of time, an alternate treatment plan may be necessary. It is possible that the tissue around the device could become inflamed or infected, or the soft tissue could grow over the device, which would also require its removal, surgical excision of the tissue, and/or the use of antibiotics or antimicrobial rinses. It is possible that the screws could break, for example, upon insertion or removal. If this occurs, the broken piece may be left in your mouth or may be surgically removed. This may require a referral to another dental specialist. When inserting the device, it is possible to damage the root of a tooth, a nerve, or to perforate the maxillary sinus. Usually these problems are not significant. However, additional dental or medical treatment may be necessary. Local anesthetic may be used when these devices are inserted or removed, which also has risks. Please advise the doctor placing the device if you've had any difficulties with dental anesthetics in the past. If any of the complications mentioned above do occur, a referral may be necessary to your family dentist or another dental or medical specialist for further treatment. Fees for these services are not included in the cost for orthodontic treatment.
If any of the complications we've discussed do occur, a referral may be necessary to your family dentist or another dental or medical specialist for treatment. Fees for these services are not included in the cost for orthodontic treatment. This is the conclusion of the Informed Consent video. When you sign the form, you are acknowledging that you understand the risks limitations, and options that may be involved in your orthodontic treatment.
If you need further information about possible risks of treatment, do not hesitate to ask your orthodontist now or at any time during your treatment. Good communication is very important to achieving a beautiful, healthy smile. Thank you for watching.